Hello everyone, welcome to your Retirement Resources Friday newsletter. Today's newsletter is going to be relatively quick, I hope. We're going to talk about the 10 top states to retire in if your main goal is good health care. And then also the new bill that's in Congress now that was recently kind of proposed that is going to give a $200 per month boost to people who are currently receiving Social Security due to the lack of, pretty much its COLA upkeep with actual inflation, and how they're actually planning on, putting this into implementation, because Social Security is supposed to run out of money in like a few years, right? I believe it's like 2036, a little more than 10 years. But that's close, right? Many people who are on just retiring, can you then imagine having Social Security stop providing you with the benefits that you were entitled to after just a decade? We'll go into those two things coming up. First though, me and my wife were just talking about this, about where would we want to retire. Just something that came up in conversation, but it got me thinking, and then this article popped out a few days back, and I thought, let's go and look. So the first state that they say is the best place to retire, number 10, is Delaware. I, for one, have never been to Delaware. It has a very expensive nursing home. It's the worst. Healthcare spending per capita is about $10,000 a year. Prescription drug price, worst. The average Medicare Advantage plans, $70, worst. And the average Part D deductible, $406, worst. They interestingly have the lowest amount of hospitals per 10,000 people, but they have the most nurses per person. Many people die from strokes here, it looks like. So I guess it's number 10. I mean, there's only 50. That's still kind of a low percentile, I guess. Let's go next one. Next one. This looks like, oh, this is interesting. This is Nevada. Nevada. Prescription drug price, it's third in the nation. Average Part D deductible, second highest. Physicians per 10,000 people, lowest third. Cancer mortality rate, fifth highest. I guess when you look at everything, all the negative things, you just can't think of anything being real positive. So Nevada, I would say many people from Hawaii go to Nevada anyway, and I'm sure they'd all hope to retire there, hopefully not gambling away their entire retirement. Number 8. Florida. I thought Florida would be higher. It looks like Florida is pretty high up there, 8. We'll just go over the top 3 things over here: cost ranking, access ranking, quality ranking. So I guess they're expensive, hard to access, but they have good quality healthcare out in Florida. Next we've got Wyoming. I've never been to Wyoming. It's 5th, tied with New Mexico for the costs. Access is 7, then quality is 4. So I guess, we're getting there as far as access, but we're also mid-tier expensive. Quality could be better, but we're in the top 5 for quality, so you're not going to get too much better. Mississippi. Mississippi. Never been here either. Cost ranking 6, kind of expensive. Access ranking 1, so that means that they have a lot of healthcare providers in the area per capita. So this probably get seen by a doctor. You probably will have a bed at the hospital. Quality ranking is 10, so that basically means, again, I didn't write this article. I don't know what this actually means, but if you're looking metrically, 10, top 10 out of 50. Left some to be desired, I would think, but at least you'll be able to be seen by somebody. So I guess you have to kind of, when you get seen by somebody, you got to kind of fish around and make sure that they're taking care of you. We have an advertisement. Okay, next, New Mexico. My sister-in-law just drove through New Mexico in her journey from Texas to Nevada. So New Mexico, number 5. Here we go. Cost rankings 5, pretty high up there. Access ranking 6, pretty good. And quality ranking 5, so they're top 5, 6 nearly, because they're tied with Idaho, so that kind of brings the position down a bit, but that's pretty good. They're in the top 5. So I think New Mexico, I didn't think that, often I didn't think that New Mexico would have good retirement or good medical, but it looks like they do. So New Mexico is an option. I'm getting to the top 4 here. Maine. Never been to Maine either. I haven't been to a lot of these places. Maine has a cost ranking of 8, so it's kind of expensive. Access ranking of 2. Pretty good, right? And a quality ranking of 6. So this is a pretty good area for people who are retiring. Looks like their average Medicare supplement plan is the worst of these areas. So your Medicare supplements are going to be more expensive. And remember, Medicare supplement plans do change their rates based on your zip code, usually by county. So it's going to be kind of expensive if you have a Medicare supplement plan out in Maine. But at least you have good access, relatively good quality. Just the cost can be kind of high. Ooh, where is this? Where is this? South Carolina. Never been here either. Cost ranking 1, so they're the least expensive. Access ranking 3, pretty good access to care. Quality, not so good. So it looks like they have a really good privatized medical. So Medicare Advantage plan and Medicare Part D plans are the privatized versions of Medicare, where you contract your federal benefits for state benefits. And it looks like that's where they're doing well, and that would make sense because Medicare Advantage plans do cost the general populace less money than Medicare supplement plans do. Medicare supplement plans, while they do cost more, they provide you with better access. So this is a place where it looks like you can get a little bit of the best of both worlds, provided you kind of remain here in their health system. All right, looks like we're at the top 2. Let's see, runner up. Idaho. Again, another place I've never been to. Cost ranking 3, access ranking 6, quality ranking is a 3. So pretty cheap, pretty good quality. Not as many providers, I guess, as you can see here. So that's kind of where they're lacking. Prescription drug prices per capita, $1,000. That's really good. Many of my clients, if I look at their plan and they're under I'd say under 2,000, it's a pretty good pricing for them. But as you can tell, unless number 1 is Hawaii, most of my clients do reside in Hawaii, and their drug costs can be frightening sometimes. But let's go check who's number 1. Any guesses? Arizona. Oh, I have a couple clients in Arizona. If you're watching, hello. Looks like there's an error here, so I'm assuming this is relatively high. Access ranking is 9, quality ranking is 1, so they have the best quality of care out here. Not real easy to access the care, and the cost is, I'm assuming it's a 2, so it's a relatively inexpensive. So healthcare spending per capita, $6,450. I thought there was much higher ones in the beginning, but who am I to say? This could have said best instead of worse, but that's where we are reading this thing. So it looks like they're pretty good. I'll leave a link to this article so you can go check out all the actual, they actually talk a little bit more about each state. Don't move based on these metrics. Always do your research first. Take a look at it, make sure it's a place for you. But if one of your main priorities is healthcare, Hawaii is not in the top 10, so I would definitely take that with kind of into your I guess mental mind frame and say, healthcare could be better, but it's not going to be better than healthcare out here because these are higher ranked in metrics anyway. You might have a great doctor who takes great care of you, would outbeat any doctor you meet in any of these states, but this is broad-based research. Next, the Social Security bill. So I heard about this a week ago, and you wonder, how can Social Security provide more money to its retirees or its beneficiaries when Social Security is supposed to run out of money, I think in either 2020, 2033 or 2036. What they intend to do is the money that they are going to quote unquote be giving out is going to be subsidized by increasing the range of payroll tax. So currently, Social Security tax is capped per individual at $147,000 a year. That's where the payroll tax is capped. Now after that, people who make more money than that in their job don't have to pay more into Social Security, because the Social Security benefit amount is also based on up to $147,000. Makes sense, right? Why would you be paying into a system more money than you could actually have like a base amount? It's like paying more for something that you can never benefit from in the future. So it's kind of like buying a stock that's, let's say the stock's $50 and it's never going to go beyond $50. It's a bond. Let's say it's a bond. The bond's $1,000 face value bond, but you have to buy it at $100 or at $1,200 every month just so that you can get $1,000 back. You know, when you collect it wouldn't make any sense, and that's why Social Security is kind of given in the way that you're never going to be paying more than you're supposed to. What they intend to do, Social Security, is to remove the cap from 147 to 250. So said in another way, they're going to give you an exemption amount from 147 to 250, but from 250 and beyond, you will need to pay for Social Security taxes on that income. Now, many people will say, and I don't mean to be political or anything, because I don't care. Joe Biden, who is backing this bill, said that every American should be paying their fair share. So there's a tax, it's not a loophole, it's legalese, tax law, tax code. If you have a company, you own a company, the company decides to pay you, let's say they pay you a reasonable salary, $147,000 a year. They can pay you that $147,000 and all the excess profits become investment income or become some other classification of income that doesn't go through the payroll system. You don't get paid it as a salary. You can do that by setting up S corps. And what Joe Biden does, many people do. It's legal. Why pay more payroll tax than you need to? They will cut off up to a certain amount, reasonable salary, and then provide themselves with taxed income. It's still taxed. It just bypasses payroll tax because it's not employee income. It's other income. It's not to be put through a payroll system. And to boost it up like that and say that each American should pay their fair share doesn't really jive with the overall message that he puts into practice. What can I say? Anyway, there's another problem with this. So if you remove the cap from folks who are paying or who will be paying more Social Security taxes, then you will have to, or Social Security will have to, raise their income cap on their benefits calculation. So I foresee one of two things. Either Social Security will increase the overall time period of contribution time or decrease the percentage base. So like, let's say if your 35 years of working credits averages $100,000, and up until this point they were using a multiplier of 5%. Maybe now they use a multiplier of 4%, because if they collect more taxes from people who are paying more taxes, the system will have to adjust for people paying more Social Security tax. So people who make, let's say they make $400,000, they pay all that $150,000 extra in payroll tax. If they don't get 2 times the amount of benefit that someone who worked at $150,000 or $147,000 did, because they paid Social Security taxes on 2 times as much income as the other person did, it's not going to be a fair system. And if they intend on keeping it a fair system, then by just kind of logic, that extra $147,000 or $150,000 in taxable income has to be paid out. And if the current system of 6.2% on whatever income amount you have isn't working now, it's probably not going to work next, in this new kind of system. We're just expanding the notional amount, but the actual equation is wrong, so it's I don't see it working. And in addition, once this kind of goes through, the adoption of S corps, LLCs falling as S corps, and the kind of corporate structure manipulation of corporate tax will just get more finessed. This entire bill, if it goes into effect, will just make more CPAs more money, because now everyone who makes over $150,000 will need a CPA to be able to file a S corp. Whatever. Just know that this bill, while seems to be such a good deal and such a necessary thing for our seniors who are, the Social Security is going up every year. You're paying more, or you're getting paid more, but the amount of things it's able to purchase is definitely dwindling. So I feel for seniors, but I don't think this is the right way to go. I think we truly need to figure out how to handle inflation. We need to stop worrying so much about the free market, and we need to just tackle things that are problematic versus try and blame whoever it is, and just try to work on solutions. So with that said, I'll leave you there. Happy weekend. Enjoy your weekend. Be sure to see my video on Monday. It's the Medicare Monday newsletter video. Do good things. Stay safe. Stay healthy. Be well. And don't worry too much. We'll see you in the next video.